Center Test Prep Exam Date 2023. Question 1. CEN tube placement is used as a temporizing measure for bleeding from Option A. Peptic ulcer. Option B. Esophageal varices. Option C. Diverticulosis. Option D. Aortoenteric fistula. The correct answer is Option B. Esophageal varices. A CEN tube is a balloon tamponade device used to apply direct pressure to bleeding esophageal or gastric varices when other measures fail. It is a temporizing measure until definitive treatment. Question 2. What is the priority intervention for a patient with an open fracture? Option A. Immediate surgical debridement. Option B. To apply traction. Option C. Cover the wound with a sterile saline moistened dressing and immobilize. Option D. Administer analgesics. The correct answer is Option C. Cover the wound with a sterile saline moistened dressing and immobilize. In the emergency department, the initial management of an open fracture includes covering the wound with sterile, moist dressings to prevent further contamination and desiccation, and immobilization of the limb. Question 3. A patient in the emergency department suddenly develops pulseless ventricular tachycardia. The monitor shows a wide complex tachycardia at 220 bpm. What is the priority intervention? Option A. Administer amiodarone 300 mg for push. Option B. Synchronized cardioversion at 100 J. Option C. Immediate high-quality CPR and defibrillation. Option D. Transcutaneous pacing. The correct answer is Option C. Immediate high-quality CPR and defibrillation. Pulseless ventricular tachycardia is a shockable rhythm treated with immediate defibrillation, not synchronized cardioversion. CPR should be initiated and defibrillation performed as soon as possible. Question 4. A high femur involves Option A. Retinal detachment. Option B. Blood in the anterior chamber of the eye. Option C. Ruptured globe. Option D. Corneal laceration. The correct answer is Option B. Blood in the anterior chamber of the eye. A high femur is a collection of blood in the anterior chamber of the eye, usually from blunt trauma. The patient is at risk for rebleeding and elevated intraocular pressure. Question 5. A 25-year-old female presents with sudden, severe unilateral lower abdominal pain and vaginal spotting. She has an IUD. The nurse's priority is Option A. Obtain a urine pregnancy test. Option B. Administer pain medication. Option C. Prepare for pelvic exam only. Option D. Discharge with follow-up. The correct answer is Option A. Obtain a urine pregnancy test. The presentation suggests a possible ruptured ectopic pregnancy, which is a life-threatening emergency. A pregnancy test is the critical first step. An IUD increases the risk of ectopic pregnancy if conception occurs. Question 6. The most effective method to control severe bleeding from an extremity wound is Option A. Elevation. Option B. Direct pressure. Option C. Pressure point compression. Option D. Ice application. The correct answer is Option B. Direct pressure. Direct, firm pressure applied to the wound is the most effective initial method for controlling severe external hemorrhage. Tourniquets may be used if direct pressure fails. Question 7. The emergency nurse suspects acute epiglottitis in a patient presenting with Option A. Inspiratory stridor, drooling, and tripod positioning. Option B. Barking cough, low-grade fever, and hoarseness. Option C. Productive cough, pleuritic chest pain, and fever. Option D. Wheezing, prolonged expiration, and accessory muscle use. The correct answer is Option A. Inspiratory stridor, drooling, and tripod positioning. The classic triad of epiglottitis includes inspiratory stridor, drooling, from inability to swallow, and the tripod position, leaning forward on hands. This is a life-threatening airway emergency. Question 8. A patient presents with sudden onset pleuritic chest pain and shortness of breath. The nurse notes decreased breath sounds on the right, trickle deviation to the left, and hyperresonance to percussion on the right. The priority intervention is Option A. Obtain a stat chest X-ray. Option B. Needle decompression at the right second intercostal space. Option C. Administer albuterol nebulizer. Option D, prepare for intubation. The correct answer is option B, needle decompression at the right second intercostal space. The presentation is classic for tension pneumothorax, trickle deviation away from the affected side, hyperresonance, absent breath sounds, and respiratory distress. Immediate needle decompression is life-saving. Question 9. The preferred medication for rate control in a patient with atrial fibrillation and rapid ventricular response who has heart failure with reduced ejection fraction is option A, diltiazem, option B, verapamil, option C, metoprolol, option D, digoxin. The correct answer is option D, digoxin. Digoxin can be used for rate control in atrial fibrillation, particularly in patients with heart failure. Non-dihydropyridine calcium channel blockers, diltiazem, verapamil, are typically avoided in FREEF due to their negative inotropic effects. Beta blockers may be used, but digoxin is often preferred as an adjunct or alternative. Question 10. Hepatitis is primarily transmitted via option A, blood and body fluids, option B, fecal-oral route, option C, sexual contact, option D, contaminated needles. The correct answer is option B, fecal-oral route. Hepatitis is transmitted primarily through the fecal-oral route, often through contaminated food or water. Hepatitis B, C, and D are bloodborne. Question 11. A patient presents with sudden onset worst headache of my life. The nurse's first priority is option A, administer pain medication, option B, perform a complete neurological assessment, option C, prepare for lumbar puncture, option D, obtain a non-contrast CT scan of the head. The correct answer is option D, obtain a non-contrast CT scan of the head. The sudden thunderclap headache suggests a subarachnoid hemorrhage. A non-contrast head CT is the first diagnostic test to rule out hemorrhage. Lumbar puncture follows if CT is negative and suspicion remains high. Question 12. Which assessment finding is consistent with a flail chest? Option A, crepitus over the sternum, option B, paradoxical chest wall movement, option C, trickle deviation, option D, subcutaneous emphysema. The correct answer is option B, paradoxical chest wall movement. Flail chest occurs when two or more adjacent ribs are fractured in multiple places, creating a free-floating segment. The segment moves paradoxically, inward during inspiration, outward during expiration. Question 13. A patient with a history of atrial fibrillation who is not on anticoagulation presents with acute onset right leg pain, pallor, and absent pulses. The nurse suspects option A, deep vein thrombosis, option B, acute arterial occlusion, option C, cellulitis, option D, compartment syndrome. The correct answer is option B, acute arterial occlusion. The sudden onset of the 6ps pain. Question 14. Which of the following is the priority assessment when a patient is found to have rhabdomyolysis? Option A, neurological status, option B, renal function and urine output, option C, skin integrity, option D, cardiac rhythm and rate. The correct answer is option B, renal function and urine output. Rhabdomyolysis involves the breakdown of muscle tissue, releasing myoglobin into the bloodstream. Myoglobin can precipitate in the renal tubules, causing acute kidney injury. Monitoring urine output and renal function is critical. Question 15. A patient with known cirrhosis presents with massive hematemesis. The nurse suspects bleeding from option A, peptic ulcer, option B, esophageal varices, option C, hemorrhoids, option D, mallory-Weiss tear. The correct answer is option B, esophageal varices. In a patient with cirrhosis and portal hypertension, massive, painless hematemesis is most likely from ruptured esophageal varices, a life-threatening emergency. Question 16. A patient with acute respiratory distress has the following arterial blood gas: pH 7.22, HACO 258, PaO 262, HCO 324. This represents option A, uncompensated respiratory acidosis, option B, compensated respiratory acidosis, option C, uncompensated metabolic acidosis, Option D, compensated metabolic acidosis. The correct answer is option A, uncompensated respiratory acidosis. The low pH, acidosis, with elevated PaCO2, respiratory component, and normal HCO3, no metabolic compensation yet, indicates an acute, uncompensated respiratory acidosis. Question 17. Which type of shock is characterized by decreased cardiac output, elevated systemic vascular resistance, SVR, and jugular venous distension? Option A, hypovolemic shock. Option B, distributive shock. Option C, cardiogenic shock. Option D, neurogenic shock. The correct answer is option C, cardiogenic shock. In cardiogenic shock, the pump fails, leading to decreased cardiac output. The compensatory vasoconstriction increases SVR, cool, clammy skin, and preload backs up, causing JVD and pulmonary edema. Question 18. When receiving a verbal or telephone order in an emergency, the nurse should: Option A, carry out the order immediately without verification. Option B, write it down and read it back to the provider for verification. Option C, ask another nurse to take the order. Option D, refuse to take verbal orders. The correct answer is option B, write it down and read it back to the provider for verification. The best practice for verbal or telephone orders is the write down. Question 19. Which finding is consistent with an anterior shoulder dislocation? Option A, arm held in internal rotation and adduction. Option B, arm held in external rotation and slight abduction. Option C, patient unable to flex the elbow. Option D, numbness of the medial forearm. The correct answer is option B, arm held in external rotation and slight abduction. In an anterior shoulder dislocation, the most common type, the patient typically holds the arm externally rotated and slightly abducted, resisting any movement. Question 20. The classic triad of symptoms for a ruptured abdominal aortic aneurysm, AAA, includes: Option A, hypertension, bradycardia, headache. Option B, abdominal pain, hypotension, and a pulsatile mass. Option C, fever, chills, flank pain. Option D, dysuria, frequency, urgency. The correct answer is option B, abdominal pain, hypotension, and a pulsatile mass. The classic triad is abdominal or back pain, hypotension, and a palpable pulsatile abdominal mass. However, the triad is present in only a minority of patients. Question 21. A nurse is caring for a patient with a suspected pelvic fracture. The presence of blood at the urethral meatus indicates the need to: Option A, insert a urinary catheter immediately. Option B, perform a retrograde urethrogram before catheter insertion. Option C, irrigate the bladder with normal saline. Option D, prepare for suprapubic catheter. The correct answer is option B, perform a retrograde urethrogram before catheter insertion. Blood at the urethral meatus is a classic sign of urethral injury. A retrograde urethrogram must be performed to assess urethral integrity prior to any catheter insertion attempt. Question 22. Carbon monoxide poisoning leads to hypoxia primarily by: Option A, causing bronchospasm. Option B, binding to hemoglobin with higher affinity than oxygen. Option C, destroying lung parenchyma. Option D, causing pulmonary edema. The correct answer is option B, binding to hemoglobin with higher affinity than oxygen. Carbon monoxide has an affinity for hemoglobin 200 to 250 times greater than oxygen. By binding to hemoglobin, it forms carboxyhemoglobin, reducing the blood's oxygen carrying capacity. Question 23. A drowning victim who was submerged in cold water has a higher potential for successful resuscitation because: Option A, cold water causes coronary artery dilation. Option B, hypothermia decreases metabolic demand and provides neuroprotection. Option C, cold water flushes the lungs of bacteria. Option D, the mammalian diving reflex eliminates the need for CPR. The correct answer is option B. Hypothermia decreases metabolic demand and provides neuroprotection. The protective effects of hypothermia reduce cerebral metabolic rate and oxygen demand, which can allow for survival and neurological recovery even after prolonged submersion. Question 24. In the Emergency Severity Index, ESI, 5-level triage system, a patient who is confused, lethargic, and has a respiratory rate of 8 would be classified as Option A, ESI level 1, Option B, ESI level 2, Option C, ESI level 3, Option D, ESI level 4. The correct answer is Option A, ESI level 1. ESI level 1 criteria require immediate, life-saving intervention. An altered mental status with severe respiratory depression requires immediate intervention, making this a level 1, most acute. Question 25. A patient with a spinal cord injury at T1 is bradycardic and hypertensive. This is characteristic of Option A, hemorrhagic shock, Option B, cardiogenic shock, Option C, neurogenic shock, Option D, septic shock. The correct answer is Option C, neurogenic shock. The loss of sympathetic innervation in neurogenic shock results in unopposed parasympathetic activity, causing vasodilation, hypotension, and bradycardia. Warm, dry skin below the level of injury is also characteristic.